How much is the Republican plan to replace Obamacare going to cost? We just found out what the CBO estimates. The Congressional Budget Office released its highly anticipated report on the American Health Care Act a short while ago. John Roberts has it and joins us now live from the White House. John.
Dana, and I just want to flag you, too, that we're expected to hear from the OMB Director Mick Mulvaney and the HHS Secretary Tom Price outside the West Wing in just a couple of minutes, so please interrupt me when you see that coming. Three big numbers to keep in mind here from the new CBO estimate. First of all, $337 billion. That's the amount of money that will be saved between 2017 and 2026 by ending Obamacare subsidies. So Republicans will say, this is going to save an awful lot of money, and it's going to lower the deficits. But here's the bad numbers, at least for the Republicans. You'll hear Democrats talk a lot about this. Because of an end to Medicaid expansion and caps that will be implemented, the CBO estimates that 14 million more people will be without health insurance in 2018. And by 2026, that number will grow to 24 million, so that in total, 52 million people will not have health insurance by 2026, compared with 28 million who would have been without it if Obamacare stayed in place. The other number to pay attention to, premium increases. The CBO estimates that a single person not in a group, and that means that a person who's not paying in through a group health insurance at their employer or something like that, will see premiums rise in the years 2018 and 2019 by 15 to 20%. But the CBO also says, because of provisions to pay insurance companies for people in a high-risk pool kick in at 2020, the premiums will actually go down. The Speaker of the House, Paul Ryan, saying positive things about the CBO estimate. We'll see what the OMB director and the HHS secretary have to say. But the big caveat that the Republicans are putting out there right now is that this is phase one, and that a lot of the cost savings items will not come until phase two and phase three. That's when they'll try to lower the price of prescription drugs, sell insurance across state lines, and also do things to try to lower the cost of health care in total. So that's a snapshot for you, Dana. We'll be hearing more about this in just the next couple of minutes.
All right. Thanks, John. Thanks so much. Health and Human Services Secretary Tom Price says the plan won't cost Americans more out of pocket.
I firmly believe that nobody will be worse off financially in the process that we're going through, understanding that they'll have choices, that they can select the kind of coverage that they want for themselves and for their family, not that government forces them to buy. So there's cost that needs to come down, and we believe we're going to be able to do that through this system.
The president addressed the replacement effort at the White House earlier today.
The press is making Obamacare look so good all of a sudden. I'm watching the news. Looks so good. They're showing these reports. And the Republicans, frankly, are putting themselves in a very bad position. I tell this to Tom Price all the time, by repealing Obamacare, because people aren't going to see the truly devastating effects of Obamacare. So the press is making it look so wonderful, so that if we end it, everyone's going to say, oh, remember how great Obamacare used to be. Remember how wonderful it used to be. It was so great. The fact is, Obamacare is a disaster. And I say this to the Republicans all the time, by repealing it, by getting rid of it, by ending it, everyone's going to say, oh, it used to be so great. But it wasn't great.
All right, so I was in Africa for a week. I came back.
Welcome home.
This issue is still on the front page. I want to just ask you, Eric, to talk about this, and if I could set it up with a little bit more of what John Roberts was saying in regards to Paul Ryan's statement. He added, Paul Ryan did, that when people have more choices, costs go down. That's what this report shows. And as we have long said, there will be a stable transition so that no one has the rug pulled out from under them. This is a tough number for them in terms of the headlines, but do you think that they'll be able to actually drive home this message that they want people to hear, which is it's phase one, and that we believe competition will drive down the price?
No, I think they need to scrap this. I think the leadership, Paul Ryan and the rest of the leadership, pulled the wool over President Trump's eyes. They said it was going to be better, it was going to be cheaper, it was going to insure the same amount of people at a lower price, and it's not. The CBO came out with basically the same price. We're talking $337 billion over 10 years. That's $33.7 billion a year. That's a drop in the bucket. But one of the things that Obamacare was imploding, one of the ways we showed that Obamacare was imploding in itself, was that fewer people were going to be insured in 2026. That's true. 28 million fewer people would have been insured under Obamacare. The problem is 52 million people are going to be uninsured under this plan, according to the CBO right now. Look, is there a plan out there that can work? Yep. But, go back, start over. and come back with the plan that works. A free market plan that takes into account competitiveness with the state lines. We're talking about that. Tort reform. Well, who's talking about tort reform? Bring that out, too. I mean, malpractice insurance is killing doctors. The drug pricing needs to come down. And here's a good one. How about making medical medical providers post the cost of what they do online? I mean, do you know how much it costs to have, I don't know, an MRI? Do you know how much it costs to have any sort of procedure? Put it online.
It's not the doctor so much as it's the insurance company.
It's both, though, Dana. They can both do that.
Ask Kimberly. So the president is sticking by them so far, the Republicans, and that what they would say is that this has not taken into account the things that he can do from the Oval Office as part of administrative actions to try to deal with some of the Obamacare plans that were in place, because a lot of that had to wait till Tom Price got into position. Now he's there. And that there are amendments that can work through to try to improve upon this bill to get to the point that where Eric is saying.
Yeah, so you want to, yes, take him for his word, but also you'd like to sort of see what the recipe is and know exactly what you're going to put in the crock pot, okay? So what people wanted to say is, listen, we rejected already what the Democrats put forward in Obamacare. So how is this markedly different and, in fact, going to provide better quality services, more affordability? Eric touched on a lot of the things, which there has to be this competition, you know, across state lines. To me, that should be step one, not stage 2, 3, or some kind of, you know, amendment or order from the Oval Office. I think people want to know up front. I don't think the CBO numbers really helped. I mean, listen, bless his heart. You know, Paul Ryan's out there trying to sell it all day long, but this shouldn't be that tough of a sale. The Republicans complained about this. They were tough on President Obama, and they should have been, but now they need to deliver, because this is catastrophic for the party if they don't get this pushed through in time in 2018.
Greg, I was thinking earlier today about how there's a lot of, obviously there's pressure on any president. There's particular pressure on President Trump because he can communicate to people like nobody else. But as he said last week, healthcare is extremely complicated, but they're asking him to shoulder a lot of it.
You know what CBO stands for? Congrats, Barack Obama. Because you know in these action movies, when the hero walks out of the enemy's lair and it explodes behind him and the hero just walks away in slow motion, that's Barack Obama. And the explosion was Obamacare. He left that behind because he knows that an entitlement, once you put in there, it doesn't even have to be any good. You're stuck with it. And I think at this point, Donald Trump could make this into a win by saying that Barack Obama made Obamacare, but he's going to make Obamacare great. Not again, because it never was great. Right. But the thing is, I go back to my original metaphor, which is that government programs, it's bubble gum in your hair. You can't get it out once it's in there, so you have to
cut that out.
You got to cut the whole thing out, and then you got a big blank splotch there. And that's and Obama knows that. That's why he's not sweating it, because he knows you can't. It's there forever. And we also have to be fair about this. It is in phases. They are talking about competition, and it comes later, and they're doing it because of reconciliation.
Yeah, they're
not dumb going like, we better not do competition. They're trying to figure out a way through reconciliation.
Methods to the madness.
The problem is with this is the most important number is that
Bob,
50.
I don't mean to cut you off, but they're saying that there's a live. I would never do this if they weren't telling me. There's a live press conference with Mulvaney and Price.
Exciting.
Thank you very much.
No, just wait. We've got more stuff coming. Why not do it all at once so we understand the full package, all phases?
Well, it's being rolled out all at once. The fact of the matter is we're working on the regulations right now. In fact, we've had a proposed rule that's been out there to narrow the window so that insurers are able to stay in markets that they're having to pull out. Remember, 1/3 of the counties in this country, 1/3 of the counties, over 1,000 counties, only have one insurer offering coverage on the exchanges. 5 states only have one insurer offering coverage on the exchanges. You tell me that that's what the plan was. The fact is that those folks have no choice whatsoever. The federal government has destined them to only have one opportunity to purchase coverage. And if that's not what they want, then tough luck. That's not our plan. Our plan is to allow individuals the opportunity to purchase the kind of coverage that they want for themselves and their family in a market that allows them an array of choices so it suits them, not what the government tells them.
Are you encouraging lawmakers to disregard this report?
No.
What are you asking?
No, we will read the report, look into the report beyond the top lines, and we'll have further comment tomorrow and talk with our colleagues about why we believe the entire plan plan that we have recommended moving forward and adopting is one that will provide greater opportunity for folks to purchase the kind of coverage that they want and put patients and families and doctors in charge of health care, not the federal government.
What's the lawmaker not giving
Absolutely. No. Thank you all. Thanks, guys. Stay warm.
I got to tell you that I love a person that can call his own press conference and say, like, that's it. Because usually it's left to the press person to be the bad guy. I'm sorry, I was the bad guy and had to cut you off. Bob, the CBO says fewer covered, more expensive. What say you?
Well, Bob, wait a second. I'm hearing there's a press conference right now. We have to go to NASA.
That's fine. That's fine. It's just okay.
There's a weather report?
It's a weather report and rose production facilities available. The real problem here is the $58 million. And it's not just for Democrats. It's Republican governors where they want to cut the Medicaid off, where they've expanded in states, are going to be very upset about this because they're going to have a lot of uninsured people on their hands. And in some ways, I mean, that is a little bit of Obama's curse when they expanded Medicaid like that. Now, all of a sudden, you're saying, boom, we're going to cut it. And the conservatives want to cut it in 2018. That's real politics. That's real votes. The budget deficit, Eric's right. I mean, it's a drop in the bucket. I don't think that becomes a good campaign issue, but certainly 58 million people do. And the government programs, you know, I've always said this, once you get them, you can't get them back. I mean, you know, particularly you give them to any governor loves them.
Can I throw something in here? There's a great opportunity for President Trump to say, look, you guys promised something. You promised that you're going to deliver to the American people something better. This is not better. We're not ready yet. Stay with Obamacare and let people eat Obamacare for another year or year and a half and say, look, in the meantime, we're going to find something better. Politically, the worst thing in the world to do is try and push this thing through and have it be equal or worse than Obamacare.
Because that's what they did.
But you know, look, put this on the Democrats. You guys are the one who wanted Obamacare. You guys are the one who pushed this through. Now we have it. Now it's going to take us a little bit longer to replace it with something better. In the meantime, it's yours. If you go ahead and say, we'll do this now and fix it down the road, and you don't fix it, you're going to get destroyed in 2018.
Yeah, you know,
that's tough to do.
The other thing, too, is that they have, that would be better politics all the way around, to say we're just not going to go forward with this thing. Trump against his own Republicans.
But he's been very thoughtful for months, saying that it would be politically expedient, yes, for me to just say, hands off, like, let's just watch it do it.
But he was also tricked, Dana.
He said it again
today.
He was also
tricked by leadership. Leadership said that they were going to deliver the complete House and Senate with this replacement bill, and they didn't have it. They thought they had it, or for whatever reason, but they never had it.
So then,
not his fault.
But then if he does that, what you were suggesting, then how do you actually put the blame on the Democrats if he's actually saying the Republicans tricked me?
Because in the meantime, you have Obamacare, which we know is in the process of imploding anyway. Let's not bail them out by giving something, by turning the blame from Obamacare to Trump care when it's not. It shouldn't be.
You know, Ryan's argument here over and over again is if we don't do it now, we're going to get killed, right? Because we promised our base. I think
Ryan Care.
Ryan Care, right? I mean, if you're going to say that, then you better have something that works. I mean, you know, he can be expedient, forcing stuff as fast as you want, but we're not too far off from the elections. And I'll tell you, if I were what Cooper said, Senator Cooper from Kentucky is right to his House Republican colleagues. You don't want to walk this plank right now. Take it back. Take some time. Think about it. I mean,
I think then you end up where Greg was saying, which is with probably nothing.
Well, right now, Obamacare is the car up on the blocks in your front yard, and everybody has to tinker with it. It's not going away. And I don't see this as an apocalypse for the Republicans. It comes in phases, and we're jumping all over them because they didn't put it all in one. The reason why they didn't put it all in once is because they wouldn't get it through.
58 million is an apocalypse.
Well,
no, 58 million is an apocalypse if you're counting on nothing else happening. That's like saying we're all going to starve to death if we don't eat dinner.
No, I'm just saying that's the most expedient political number for the Democrats.
Yeah, of course. Yeah, of course. I milk it for all it's worth.
The most expedient political number is, forget 52 million in 2026. Next year, 14 million. 14 million people will lose their health care under this plan.
What percentage of that is Medicaid?
Whatever. Half.
Half?
All right. We're going to